Good afternoon, ladies and gentlemen. Dr. James Lyons-Weiler coming to you live from the WWDNYK studios in Pittsburgh, Pennsylvania. Today I have a very important message and I need your help. And this is going to help you too. We have in the state of Pennsylvania, the Governor Wolf shutting down the rest areas. And that means that there's going to be, they're putting out porta potties at the rest areas. And that means you're going to have people in a very enclosed space less than 4 feet away from fecal matter. That fecal matter itself is infective with coronavirus if a person uses that porta potty. It's ridiculous. There's, I don't know, tens of thousands of people that go across the turnpike in Pennsylvania. But that's not what I'm asking your help for. What I'm asking your help for is to help spread the news of a new measure that I have. I'm looking at the news story. If I go to my kind of default browser here, the U.S. plan predicts, anticipates an 18-month pandemic and widespread shortages. 18 months, the New York Times is saying. What else do we hear that's going to take 18 months? We hear that it's going to take a vaccine 18 months. I don't think that the U.S. economy can withstand 18 months of this, and I already know that the U.S. government's, although President Trump has said he's going to be sending out 2 checks of $1,000 each, make sure that the federal government has your proper address if you want your COVID-19 money. We are not going to be able to withstand 18 months of this. It's ridiculously and patently absurd to think that for 1 minute the American public is going to put up with this kind of isolation, this kind of loss of business, this kind of loss of income with this shutdown. It's not going to happen. But at the same token, the American public is not going to allow 20% of our elderly to die and 6% of our people with diabetes to die and 20% of people with cardiovascular disease to die. So this is what I want to show you. I have some good news on rates, but it's not the rates that you think of. Most people, when they're thinking about COVID-19 and SARS-CoV-2, they're thinking about the number of new cases, and that's the right thing to think about at the surface. But today I derived a new measure. It's an estimate of R0. R0 is the number of new cases that if you're infected, you can expect to create by being out about in the public. And social isolation, social distancing is very important. It helps shut down the rate of the rate of new infections, the number of new cases per day. But we really don't have any idea about what the effect of that is if we just look at this geometric or this exponential curve. If we look at an exponential curve that's occurring, say, in the United States, I'm going to show you that to date. Here, this is the number of total cases accumulating here. This figure right here. Since the first day of the we see these kind of like small little differences in the curve from day to day, but we don't know what to make of them. The human mind looks at that. We really don't understand exponential. We don't understand logarithms. It's not intuitive for our mind to think in terms of multiplicative processes. As smart as we are, it's just I can't tell you what's going on with that curve. It doesn't matter. I just look at it and it could be this, it could be that. If you've had calculus, you might have a better understanding about what's going on, but there's something about the biology of this virus that we know that we're not taking advantage of. We know that there's a 4 to 5 day asymptomatic transmission period, and therefore we can actually get an estimate of the number of new cases that have occurred as a result of the number of cases that existed 5 days previously. And the interesting thing is that there's a lot of discussion about there's asymptomatic cases. Testing has gone wrong. We really don't know what's going on with testing. For every 1 case, there might be 5 cases, 10 cases, 20 cases. We don't know because there's no testing. It turns out that as long as the ratio during the growth phase, if the ratio of existing cases to unknown cases is constant, and there's no reason to expect that it's not, right? Except for people are getting better at diagnosing, small things like that. Contact tracing is all but done in the United States, so it's the Wild West right now. But as long as the ratio of the number of cases that are known to the number of cases that are not known on a given day is relatively constant, we could just take the ratio of the number of cases that exist in the country on a given day to the number of cases that existed 5 days ago as a measure of effective R naught. That tells us the rate at which we're spreading the disease. And I'm going to show you some results that are kind of remarkable. The results are remarkable when I plot this out for the United States. Let's go to that right now. This is on my blog article. The blog article is entitled Estimating Effective R naught. COVID-19 Data Resources should report this for all countries. Every country needs to plot this out for their data. You see the number of cases on day X divided by the number of cases on day X minus 5. It's very simple, but it's seductively simple. We're going to talk about some ways that this could be misleading and when it's not appropriate. But look at what happened here in the United States. Here we started on day one. There was definitely some increases, and then it kind of petered off. There's no testing, no reporting, and then there's something came up, and then no testing, no reporting. Boom! All of a sudden we have the boom there, okay? And then this is not the number of cases. This is the ratio of the number of cases on a given day to number of cases day 5 days before. Then we reach this exponential phase here, and we can see that during that period of time, it was increasing dramatically. And then President Trump did what? He announced a national emergency on March 13th. That is the date which everybody started behaving differently. And you can see this. We need positive feedback on what we're doing. What we're doing is working. It's very effective. The pain and suffering that you're experiencing right now, the fact that you have to stay home, the fact that you don't have your group meetings, the fact that you can't do the things you used to do, the limited time that you're exposing yourself to other people, it's working, people. And so this is what we need. We need this measure so that we know that what's happening is actually being effective. And I want to thank everyone in the United States and around the world for doing everything that they're doing to try to shut down this R naught and bring it down to less than 1. That's the goal. And what you're doing is working. It's good, okay? It's positive. This is a very positive measure. If this was continuing to go up and up and up in spite of the social distancing and that kind of thing, I would be really concerned. I'd be dastardly concerned. But and see, I'm kind of drinking the Kool-Aid a little bit by saying that I would be concerned if it was still going up. The fact that it's going down is good news, but it's the bad news, and this is horrible news. It is still not below 1. It has to go below 1, and we have to keep it below 1 for a long period of time. What that period of time is, I don't know. I'm going to model that later, but we have to get it down below 1. We have to keep it below 1, and we have to get it down and keep it below 1 as fast as possible. And social distancing is working. It seems that we're headed downhill here, which is great, right? That's great. But that doesn't mean that it's going to be over soon, and it doesn't mean that that we can be complacent. So don't confuse this measure, effective R naught, which is a ratio of the number of cases today to the number of cases 5 days ago, with a measure that says, oh, look, we can relax. It's not a big deal. I can go out. I can, skip my 14-day. No, you can't. What this is like pulling a person out of the water. A person's drowning out of the water, and you're in the boat, and you're pulling them out of the water, and you have them 10% out of the water. That's where we're about at, or 20% out of the water. And you're 50% out of the water. You have them 80% out of the water. You don't stop. You keep pulling the person all the way through, because if you don't pull that person all the way through, but you have them 10% out of the water and stop, they're going to fall back in. 15, 50%, 80%, 90%. You can have them 99% out of the water, and they could fall back in. You have to keep going with this and keep going and do more of what you know is working. And so for those of you that are kind of like on the fence about social distancing, and maybe maybe you think it's all a big conspiracy and you're not participating in this, these numbers are unitless numbers. This is the number of cases on a given day. It's case per case. So these are unitless numbers. Everything else cancels out. All the conspiracy theories cancel out. Whether it's maybe the death rate is only 0.05%, maybe it's not 2%. That cancels out, because in reality, what we have is a public policy that anticipates 18 months, not weeks, 18 months of social distancing. And if we have 18 months of social distancing, that will absolutely devastate our economy. There's no doubt about it. They're shutting down plants in Detroit that are manufacturing cars. They're shutting down plants in Detroit that are manufacturing cars. You want to hit the heart of America? Shut down some plants in Detroit that are manufacturing cars. So what I said was we want to get this rate down below 1. We're not there yet. We need to add something. Well, we can't wait for 18 months to add something, so I would encourage all of you to go also to my blog and read How the COVID-19 Pandemic Will End. I wrote this about 5 days ago, all right? What I did was I did these simulations, and here's social distancing, the effect of social distancing with no therapeutics, no treatment at all, and it still is going to increase. This is now the number of cases in a given day. This is social distancing, very effective, very harsh social distancing with no treatment, okay? And this is what happens with social distancing at 98%. With no treatment. It's a steady state with a large number of cases that our epidemiologists are going to tell you, well, we have to maintain that social distancing to keep this low, steady state. Well, we can't maintain the social distancing. Now, if we add 99% social distancing, then we start seeing something that's effective. That's the draconian measure, part of the draconian measure that China did. But China also did therapeutics. They did therapeutics where here you have a treatment of 37%. That's either 37% of the population in a country are getting effective therapies that work 100% of the time, or all the countries getting therapies that are only 37% effective. Either way you look at it, it's the same thing. All right? As long as it doesn't mask symptoms and cause you to walk around and think that you are not infected. So NSAIDs, ibuprofen, reducing your fever might make you feel good, but there are citizens that are being tried in countries like in Italy and in Romania. They're masking symptoms or they're hiding symptoms. In China, you go to jail if you mask your symptoms and try to hide it, try to get by a screen. So here's social distancing 60% with 38%. So I'm putting social distancing at 60%, 39% treatment. You see how these curves drop down? These curves drop down very quickly. The more effective the treatment is, if you hold social distancing for a short period of time, within weeks, we can end this within weeks, people, not 18 months. This is excellent news, and the Chinese did it. They did it not alone. They did therapeutics and social distancing. That's what the Chinese did, and that's what we need to do. We need everybody to go to my blog, get the link, jameslyons-weiler.com, go to my blog, get the link, and share these articles out everywhere. Share them with your senators and congressmen. Share them with your health officials. Share them with everybody, and demand therapeutics. Now, what kind of therapeutics am I talking about? Those articles have them listed. Plasma convalescent therapy is one that I've talked about, the one that was used in China. There are antivirals like remdesivir. There are others that are listed there, very, very important ones. One that's skipping my mind right now. But I want everybody to make sure that you read this and understand the differences between these curves, which are the number of cases, okay, and the curves from today's blog article here, which represents IPAC research now, of this curve right here is effective R naught. Now, you've all learned about what R naught is. That's the number of cases that a person will affect. So I'm doing a retrospective representation of this. This is the number of cases that did infect, right, in the future. Now, let's talk about where now, I know that there's a lot of analysts out there that are going to be saying, well, there's so many different factors that affect this. There's so many factors that affect this. This is ridiculous. There can't possibly be a simple measure like that. There's the nature of the virus. It might be evolving over time. Fair enough. That's true. There is whether people are isolating or not. Well, that's the effect. That's the point. This measure is sensitive to that. And I list some of the other ones here, some of the other things that could be. So I put a section down here, how to interpret effective R naught and how not to interpret effective R naught. It gives us a general idea of the direction in which we're going. It does not mean that it is the number of people. Here we have an R naught, effective R naught of over 5 in the United States, about 10 days ago, within the last 10 days. And was it that high? I don't know. I'm not saying that it was that high. What's going to happen when we start testing? We're going to see this thing explode. Okay, so from that point forward, then we can start then tracking 5 days. All of it will cancel out. The testing cancels out. 5 days later, testing cancels out if you're still testing at the same rate. So all those variables are mentioned here. And that's why I'm saying it is not a direct measure of R naught, but it gives us an idea about where we're going at a point in time. So, you really have to push for therapeutics because we know that we're still above 1 here. It's still above 1, and that's problematic. We're not going to get anywhere unless we get below 1, and we get below 1 for a sustained period of time. The modelings that I've seen, that I've conducted, are also very simple models. These other ones are very simple models that use a very simple recursive dynamic modeling to bring it down, with very, very effective treatment. So chloroquine phosphate. There's an expert statement by the Chinese scientist on chloroquine phosphate. Look up, if you're a medical professional, look up chloroquine phosphate and look up the antivirals. Go to my website, jameslyons.weiler.com, and I want you all to know that although I do fundraise for IPAC, I don't have any financial interest in whatsoever in antivirals. I'm not invested in any company. All right, I'm not invested in plasma therapeutics where I might personally make some money. What I'm interested in is reducing human pain and suffering. And so this particular podcast is Unbreaking Science, WWDNYK Studios, and you can become a monthly Patreon at patreon.com/WWDNYK. You can do a small monthly donation at IPAC if you want to drive forward the research that we talk about. You can go to jameslyons.weiler.com, and I think there's an option there as well where you can make a donation to the blog. That's direct gifting to me. My point being, for me, this is not about money. For me, this is getting America back on track. My initial article that got a lot of attention is this one here, things you don't yet know but need to know about the novel coronavirus. This was really early on. This was a month ago, about a month. Well, it's 2/28, so this is in February. There's 21 points here, and even then it includes that we need therapeutics. So this is a race against the virus, a race against time, and a race against bad policy and the economy. It's terrible, terrible, terrible public health policy to say we're going to wait 18 months just so that we can get a vaccine. Dr. James Lyons-Weiler signing off to you. If you like what you've watched, subscribe. If you're on YouTube, if you're on Facebook, please find us at Unbreaking Science, hashtag Unbreaking Science, and the WWDNYK Studios group. Like and follow those groups, and make sure that you share, because sharing is caring. These blog articles, I'm asking you specifically to read and share the blog articles with professionals that are in policy making decision capacities. We can have the debate about whether or not this is an actual measure of R naught at another time, because it's not an actual measure. I'll concede it's not an actual measure. It's a very simple measure, but it gives us like a compass. It gives us a general idea of what direction we're headed. So James Lyons-Weiler coming to you from Pittsburgh, Pennsylvania. Good luck. Stay healthy. Stay safe. And take excellent care of each other.